difficulties.
Hi, everyone. Welcome to the show. I'm Dr. Nicole, and on today's episode, we're talking about mental health, specifically all the things that aren't typically focused on in traditional mental health evaluation and treatment, but should be. My guest, Brendan Vermeire, is a good friend and valued colleague of mine, and his personal story and professional work is going to be so empowering for you to hear about. We're going to cover the big picture of what needs to change to better meet the needs of kids and adults with mental health symptoms. And we're also going to dive into some specifics related to things like the gut-brain connection, brain cell health, and more. But before we get to all of that, let me tell you a little bit about Brendan. He's a mental and metabolic health scientist and researcher, functional medicine educator, writer, and speaker. He's a board-certified holistic health practitioner, master nutrition coach, personal trainer, and CrossFit trainer. He's the proud owner and founder of the Metabolic Solutions Institute for Functional Health and Fitness Practitioners and the Metabolic Solutions Research and Education Foundation, a not-for-profit foundation dedicated to changing the way the world views mental health through advancing the science of mental health dysfunction. He's also the creator of the Mental Map, which is a cutting-edge lab panel for mental health. I'm so thrilled to have Brendan with us today. Thanks for being here, friend. Welcome to the show.
Well, thanks for having me, Nicole. It's so good to see you again. I feel so spoiled that we've gotten so much quality time together while we're both in our Airbnbs in Arizona. So it's really a pleasure to be here.
That's true. For our listeners, I have been spending the month of February getting out of the cold in Michigan and in Arizona. And Brendan and I were here for some work things, and I've gotten to spend some time together in person. So it's been great. And the sunshine doesn't hurt either. From a mental health standpoint, of course, right? It's like, oh yeah, mental health, sunshine's a good thing.
Yeah, just a little bit.
That's right. I would actually love to start by having you share a bit of your story of how you even came to be in the world of mental health. I mean, you've been trained in fitness and all those things, but I know that the mental health piece is really grounded in your own personal experience. And so I'd love for you to share with listeners your story and how it brought you to the work that you're doing today.
Yeah, absolutely, Nicole. It'd be a pleasure to share. I'm really an open book on that subject because I think a lot of people can relate and resonate with some of the struggles that I went through. So obviously, it really is the story of my entire life, but to kind of give a Cliff Notes sort of synopsis overview of some of the major events that happened, I think starting from the beginning where I was first put on a psychiatric drug at the age of 17. So I was in high school, I think it was my senior year, and I was just doing a physical to participate in sports. And my primary care physician put me on Zoloft. And I don't remember exactly why. I think I mentioned something about seasonal affective disorder because, it was wrestling season coming up and, darkness and winter, and I always get kind of sad, kind of blue in the winter. So there was no blood work of any kind done, no referral to a mental health professional, just here you go, kid, here's Zoloft, right? And hey, I'm just a kid, I'm doing what my doctor tells me to do. And the Zoloft made me feel worse, a lot of anhedonia and apathy, and just kind of felt like a spaced out zombie. And that was when I was 17. And over the years, which obviously 17 to 21, 22, those are very critical neurodevelopmental and psychologically developmental years as you're going from childhood to adulthood and trying to figure out your life plans of, do I go to college? Or I actually joined the Navy for the SEAL program. And it was actually, I was in boot camp and they found I had a pre-existing injury. So I was medically discharged. And that really felt like that was my life goal, my life plan that just got ripped away from me, due to circumstances I had no control of. So, here I am, 18, 19, I'm working at the gym, like scrubbing toilets, folding towels, and doing janitorial work. And my mental health just started getting worse, to be honest. And I did eventually move on because I needed something to focus my intense kind of obsessive personality towards. So that's when I got certified as a trainer and nutrition coach, because I was always very passionate about health and fitness and nutrition. And I got started with that career, which in many ways kind of saved me. But in the early stages, my mental health continued to decline. And so when I was about 2021, I found myself in front of the same primary care. And this time it was like, oh, well, Zoloft didn't work. So here's Wellbutrin. Let's see if a dopamine drug works better. And same idea. But this time, 4 years later, he did refer me to a psychiatry clinical psychology clinic. And so I underwent, a battery of subjective computer, assessments to test for attention time and focus and personality quizzes, and ultimately was diagnosed with ADHD and major depressive disorder. And so then they put me on Vyvanse and Adderall on top of the Wellbutrin and referred me to work with a therapist. But it was actually 2 weeks later that I woke up in the intensive care unit breathing out of a tube because I ran into a big crisis triggering situation. And I think especially too, the weight of those diagnoses just made me feel even worse, right? Like I'm broken, I have these illnesses, there's a lot wrong with me, and now I'm experiencing this really traumatic event. So I swallowed my entire bottle of Wellbutrin and woke up from a medically induced coma like 3-4 days later. So I had to go through the psychiatric model. I was inpatient where they just tamper with your drugs without even communicating to you about it, just to, stabilize your crazy brain chemicals. So I experienced firsthand how dysfunctional the conventional psychiatric model really is. And then I went back to my career in holistic health and fitness. But I just kind of kept pulling that thread, right? I didn't want to be on the medications forever. I wanted to be able to help myself, my loved ones, and others. So it just became this organic evolution as I went from, fitness and nutrition to holistic health and then functional medicine. And in my functional medicine career, I was like, all right, I really kind of need a niche down here for the sake of business and branding. And who am I trying to serve, right? If you try to serve everybody, you don't help anyone. So I really decided like mental health is what I'm most passionate about. And now I love the work that I'm doing at the kind of root cause level.
Mm-hmm. It's awesome. And I so appreciate you being such an open book with sharing your experience, because unfortunately, one of the big battles we still have going on in the realm of mental health is so much stigma and people feeling like they need to keep these things a secret. It's not okay to talk about them. And that actually is so much more harmful for people. And especially, I love that you are a man sharing about your experiences at those pivotal ages, because my experience clinically is a lot of young men experience these things at those significant developmental points, and they feel like they're not supposed to talk about it, or their families even don't talk about it, sort of like, no, don't talk about that. And that just puts a whole lot of guilt and shame and everything else on top of the struggles. And so I think you're just providing such a powerful role model for young people, for young men in particular, and for the parents out there who are raising them, around being open about your story and not feeling like you need to hide that or be ashamed of it, and saying, this is something that happens and let's talk about it.
Yeah, I really appreciate that. And I think you're so right. It made me think of when I was going through that crisis, my parents didn't know how to handle it. They didn't handle it well. I really can't say that they supported me the way that I needed when I was going through it and kind of the aftermath of it. And, here we are like 8 years later, never do they mention it. Like it's like it never happened, because they still are so uncomfortable with knowing how to even speak about it. Like they almost lost their son.
Yeah.
And they still to this day just don't know. And they see what I do professionally and they're proud of me. But I think a lot of parents are not emotionally equipped, let alone equipped with like the knowledge of what's going on with mental health. And especially there's this weird thing going on in society these days, like with Simone Biles pulling out of the Olympics for her mental health, which became this huge media craze. But I think there's a little bit of the pendulum swinging the other way, where we're going from you shouldn't talk about it at all, and there's the stigma and taboo. But then now I think it's almost getting distorted the other way, where it's like, well, thank you for your vulnerability. So now you have people speaking out and they're seeking affirmation, right? And they want people like, oh, you're so vulnerable, you're so brave. Right. And too much of that isn't really helpful either. It's like, let's actually talk about what's going on here, like scientifically, and start educating of why is because it's not like it's just me or the audience,
Right.
it's the majority of people are struggling with their mental health. So what are we doing collectively? Why is this going so wrong?
I think that's such a good point, because so often the conversation around, the newer conversation around it, well, let's break the stigma, is just, well, let's talk about it. Let's talk about all the problems we're having. And okay, that's good to be more open. Let's not keep this a secret. Let's not pretend it's not happening. And at the same time, to your point, but let's also start talking about what's actually going on and the solutions, because otherwise, as a society, and I think this is especially like a Gen Z and maybe a bit of a millennial thing right now, everybody is just bathing in this pool of all of our problems and our symptoms and our diagnoses. And while it's good to be open about that, if we don't shift into okay, let's understand what's happening so we can do something about it, yeah, that just becomes an even more depressing and anxiety provoking thing.
Absolutely. It's great to be open, and there's a difference between like authentic, genuine vulnerability versus affirmation seeking behavior,
Right.
and sort of the, self-indulgent narratives that I think people find to be relatively, addictive and whatnot. But yeah, like we actually have to look at what's going on here. And it's crazy when you actually look at like what big pharma is doing for mental health and what's coming down the big pharma pipeline. Like there's a lot that we can extrapolate from what's going on there. And we start kind of holistically looking at the standard American lifestyle and environment and sociology. And it's like, well, no wonder everybody's, struggling a little bit.
Right. Well, let's talk about that piece about so many people struggling, because I think that it's really interesting to look at the landscape of mental health right now, particularly as we're, wrapping up year 2 of this pandemic situation. Like, my opinion based on what I'm seeing clinically and just, hearing from people in my personal life, my professional life, is that we're seeing a lot more people struggling with what we could call like mental health symptomology, whether we're talking about young kids or teenagers, or we're talking about adults. Like we seem to be experiencing collectively a whole lot more, everywhere from mild to quite severe symptoms in the range of our mental health. I'm curious what you're seeing with that and your perspective on that.
Oh, for sure. I mean, we can look at some of the data from the CDC to get a little bit of insight there, where in the first month of the pandemic, February to March of 2020, we saw psychiatric drug prescription fills go up like 34% in 1 month, right? And the CDC actually just recently released the data from 2020 of all-cause mortality. And so in 2020, the top 2 killers of Americans were heart disease #1, cancer #2, COVID was #3, which I don't think we need to dwell on that, but I think that's notable of considering that stole the show. And it was #3. And heart disease actually went up by a statistically significant margin from previous years, but it's still dominant at #1. Whereas the 10th leading cause of death for years now, including 2020, is suicide. And suicide and the reason why it's not higher is because we have an aging population.
Right.
But if you look at suicide for ages, I think it's like 10 to 34, it's the 2nd leading cause of death.
Yes.
Right. And Alzheimer's, which is neurodegeneration, is #6. Diabetes is 7. And so you start looking at, and I have some beautiful graphs that illustrate this, of like obesity rates, diabetes rates, suicide rates, mental health rates. They all go up concomitantly. So it's like, maybe there's some sort of correlation between mental health and metabolic illness. But of course, our conventional system, it's like, well, no, your heart disease has nothing to do with your IBS. That has nothing to do with your anxiety, right? We segment the body's systems. Whereas like when we look at it holistically and from like a root cause kind of etiological perspective, yeah, there's, metabolic illness is kind of the primary underlying cause of a lot of these mental health disorders. Whereas, as you can appreciate as a clinical psychologist, maybe like 100 years ago, mental illness was a little bit more severe and pronounced. Of most people were metabolically healthy and fit and, slender, thin, healthy BMI, body weight, so on and so forth. So then the mental illness was more the schizophrenia or autism or, extreme bipolar. It was a more extreme sort of epigenetic presentation that really stood out a lot in our society. Whereas these days, well, that's being exacerbated and potentiated and blown up. But the depression, anxiety, and insomnia and brain fog, that's like everybody because
Huge.
of a lot of this kind of chronic inflammation, metabolic illness milieu.
It's so true. And I think, you just communicated really well how those things are going up in tandem with one another. And I think that the conversation around that tends to be for an adult population. But I want to really spotlight for all of us that this is very relevant to the population of children and teens, because we are seeing metabolic syndromes, metabolic disorders in children, even young kids now, that we never used to see. The rates of obesity are dramatically higher than they were when I was a kid. We see children now regularly with fatty livers. We never used to see kids be diagnosed with non-alcoholic fatty liver disease, right? We're seeing children now at increasingly high rates being diagnosed with type 2 diabetes. Even 15, 20 years ago, if a child was diagnosed with diabetes, it was type 1 diabetes, right? And now we're seeing this lifestyle. So we're seeing this more and more. And at the same time, to your point, we're seeing exponential increases in neurodevelopmental and mental health issues in kids. And we cannot separate these two things. And yet you're so right that in the dominant paradigm, there's medical, there's mental health, and they are separate things. So I would love for you to take us through some of those connections, because you focus a lot on metabolic health as an important part of mental health, like those pieces together. And I think there's a lot of people listening who are like, well, okay, so I get that, the brain and body are connected, but how do things like, obesity or blood sugar or, those types of things, how do those, connect to the problems that kids and adults are having with their mood, with their attention, with their behavior? Help us kind of connect those dots.
Absolutely. I always find it helpful to zoom out before zooming in because, zooming in, it's like you stick your head in the sand, it gets really myopic, reductionistic, where, we zoom out and at more of kind of a little bit of an esoteric level, we have to look at, we're the only living species in existence that doesn't live symbiotically with the natural world. Like, we think we're a higher evolved species, but we don't live in harmony with nature, which that should be a huge red flag at a collective level of like, maybe that might bite us in the butt someday. And it is, right, within the past 50 years, especially. But really what I'm getting at there, looking at environmental health we have an increasing toxic environment, which there's an obscene amount of research behind environmental toxins and mental health disorders of things like the glyphosate and the xenobiotics and the plastics and, all the environmental toxins that we're exposed to daily. I think everybody in the world has heard about that study where it's like over 200 chemicals identified in the human placenta, of newborns. So there's the environmental toxicity aspect, there's the social isolation and not living with nature, but we're all just spending our time inside on the computers, blue light blasting. So just kind of the simple message of not living a more natural, harmonious with one another in the environment lifestyle, but even from more of a lifestyle perspective of sedentary lifestyle, processed food, disrupting our sleep, very stressful and kind of sympathetic nerve system stimulating lifestyle, very dopamine highs. We're always looking for that next high, whether it's the slushie at the movie theater or how many likes did we get on social media. So there is that kind of behavioral component to it. But as far as like with metabolic illness, we know that obesity and high body fat, we know that that causes more inflammation in the body. We know that that inflammation can drive a lot of brain dysfunction and neurochemical, brain imbalances. So we know that that excess body fat that even these kiddos are packing on, obesity rates in kids, diabetes, the non-alcoholic fatty liver. We have plenty of research in seeing exactly how the high blood sugar and all the molecules associated with that, or the fatty liver with the ceramides and fatty acids and junk that the liver's spitting out, it actually causes a stunting of the brain's development and can drive actually neuroinflammation and neurodegeneration. Now they're starting to call Alzheimer's a type 3 diabetes, right? So the body fat, the blood sugar, just from like a basic fundamental metabolic health perspective, which is horribly relevant to all the kids these days, from my perspective, I mean, we can't be kind of talking about mental illness and treating mental illness in that vacuum reductionistic paradigm. We have to hey, this child is metabolically compromised. Yeah. Let's get them eating real food and moving and out in sunshine and being social. Right? They need that stimuli for not just their psychological well-being, but literally their neurological, the cells of the brain itself.
Yeah, it's so true that the milieu that we raise kids in today is so dramatically different, than previous generations. And I think you connected those dots really well. And it's so unfortunate that our healthcare system is so in the dark ages as far as operating as if these connections exist, right? We've known for decades now that the brain and body are connected, that metabolic health and mental health are connected, that how our brain functions has everything to do with how our body's functioning. And yet our systems of care still operate as if that's not true, right? And so we send kids, who are having behavioral issues or mental health symptoms or developmental problems, they very quickly get shuttled into the system of mental health care of the schools for education, and nobody is looking at and connecting those dots for them. And then we wonder why they continue to struggle and why parents feel frustrated, because we're leaving out that whole piece for most of these kids around why they have developed these problems in the first place.
Absolutely. I think back to my childhood, I was outside and active all the time. I think I ate all right for a kid from my generation and whatnot, but I've been watching Cobra Kai on Netflix, and there's the son in the show who he's like the prototypical, he's an overweight kid who's addicted to his processed food, his sugar, and staring at his iPad. And, the dad's trying to get him to do karate, which it's fun for me because I did karate growing up and whatnot. So I'm looking at this prototypical kid of that's the standard American kid that is going to have the depression, anxiety, ADHD, right? And I don't know what's going on in school systems anymore, but what happened to recess? What happened to moving in the sunshine? Right. Yep. Why do it's crazy to me how for decades now, we have always recommended to, geriatric patients with progressed neurodegeneration to do physical therapy, to do puzzles, because it slows down the neurodegeneration, but we don't apply that same logic, to the kids. We're just nah, just put them on Ritalin, it'll be fine, right? Yeah.
Right. And we put kids on all these things so that they will better fit in the artificial boxes of childhood that we've created. And then we go, oh, what could possibly go wrong? We create a developmentally inappropriate, weird box that they need to exist in school, in society, whatever. They don't do well with that. So then we medicate them to fit in the box. And then we wonder why everybody's so dysfunctional.
Yeah. And then now we're trying to normalize the dysfunction. We're trying to normalize the increase in neurodevelopmental disorders, right? 1 in 44 kids these days are born with autism. And, I just saw a show on Amazon Prime that's about autistic teenagers trying to live life and whatnot. So we're trying to normalize it, just as we're trying to normalize, obesity and being overweight. I've seen billboards in various cities that, obesity and this is healthy. And it's okay, there's a difference between shaming somebody versus enabling self-destructive ideology and behavior. And that's a slippery slope as soon as we start normalizing something that we know medically is unhealthy and is an economic burden, right?
Right. That's right. And my thinking is like, because sort of what you're alluding to there in the realm of neurodevelopmental stuff is the whole, movement towards, just a difference in processing, being neurodivergent, all of that, which I think from the standpoint of accepting people for who they are is awesome. And for taking the stigma away and the shame away from maybe having processing differences and being a different, having a different type of brain. I think that that's amazing. And where I think it crosses the threshold into being problematic is exactly what you're saying, of normalizing very significant symptomology that actually is not part of that neurodivergent profile. We can talk about thinking differences and personality differences and ways of being all day long, and that's great. But a lot of these children and now adults are struggling with very severe issues of sensory processing, anxiety, unstable mood, sleep dysregulation, all of these things that are being normalized as part of being neurodivergent. But actually, those are real physiologically based issues that we can help people with. I'm not interested in making a child be someone they're not, in taking away something that is unique to them, or making them fit into a certain mold. I am very committed to making sure they're sleeping well, that if they're living with paralyzing anxiety that's preventing them from functioning, that we're doing something to reduce that, right? That we are helping them feel comfortable in their own skin. Like, these are important things. And I think that nuance is getting lost in that discussion, as you said. Yeah.
I think you're so right. It is the nuance that people aren't talking about. It's like, pick a side, pick a camp and jump in. It's like, actually, it's a very nuanced conversation, because what we're talking about is, regardless of what spectrum somebody might fall on, we're trying to improve their functionality so that they can express themselves, their unique characteristics, their unique neurodevelopmental gifts to the highest degree. Like, you could have two twin boys that are both, diagnosed as autism spectrum. One could be much higher functioning than the other, depending on, the epigenetics, the lifestyle, the environment. Like, if those two sons lived in separate homes with separate parents, one's eating processed food and sedentary and whatever, the other's active, eating real food, who do you think is going to be able to express their uniqueness at a healthier degree versus a more dysfunctional degree?
It's a beautiful example. I think that's so true. Let's delve into some of these specific connections, because I think, it's important to touch on the connection here between the gut and the brain, because this is another piece, again, that we have had good research on now for a while that is largely being ignored in mainstream mental health treatment. So talk to us a bit about first of all, what the gut-brain axis is and why you feel like this is important for us to be looking at, from the standpoint of understanding, and sort of evaluating what's going on, as well as treating and supporting somebody.
Oh, absolutely. The gut-brain axis is so huge. And when I think of root causes of mental health dysfunction, I'm immediately thinking just good old metabolic health, as we've been depicting, and then gut health and the gut, liver, brain axis. There's all these axes, but it brings to the conversation the subject of the microbiome, which we just can't emphasize enough, right? Like, obviously our understanding of the microbiome is very much in its infancy overall, but we know enough to realize there's like no disease or condition that isn't directly related to the microbiome. And we're in this sort of extinction event, right? So I always like to think about the microbiome as the garden of life. It's, all these different types of microbes, parasites, virus, fungi, bacteria, archaea, so on and so forth, that they live in us and on us, and they're all around us in the environment. And this is where, like, just by living not very close to nature anymore, like, we evolved in nature. We used to live in the dirt and live in caves and drink from the creeks and the streams, whereas now we're in this germ theory, like, sterilize everything, right? And especially the past 2 years,
now,
I've never seen so much fear of germs. And so we are quite literally killing off the building blocks of life itself, that are these microbes. So with the gut brain axis, it's like we've got the second brain in the gut, the enteric nervous system down there. And it is all those microbes that give us our functionality. That's where we got our neurotransmitters. That's where we get a lot of the molecules that actually helps our brain develop. So when we're talking about neurodevelopmental disorders from birth to age 10 and everything, like those microbes and that gut health and that garden of life gives us so many signals that will either cause kind of a stuntedness of how the brain is developing and wiring it within itself, or really healing and regenerating and promoting. So this is where we kind of have to learn, like, how do we grow a healthy garden in our gut, right? And all the antibiotics and processed food, and there's conversation be had around vaccines, obviously, as well, and all of that. But everything we're doing is kind of disrupting that gut-brain axis that drives a lot of the symptomology that many of us are experiencing.
Yeah, and even sort of our culture of high stress, right, creates a problem there. Like, and it's not just for adults. The American Psychological Association releases their annual report on stress in America. And they look at it for adults and kids. And when we look at it for children and teens, what we've seen is those numbers steadily increasing in terms of the number of kids who are experiencing high levels of stress. And I found it really interesting. This was, I think, I don't remember if it was the report that they released in 2019 or 2020, but what the takeaway is that our teenagers, our high school age teens in America, experience a level of stress now that middle-aged adults were reporting 20 years ago. And you think about that, our children, our high school age kids experiencing the same level of stress now that middle-aged adults have historically experienced. And of course, without the brain maturity, the coping skills, the intellect, the experience to be able to regulate that, it's become really toxic. And stress has a huge impact on the microbiome, doesn't it?
Oh, absolutely. I mean, we see through literature how stress can increase the risk of neurodegeneration long term, and it suppresses immunity and digestive function, right? So it's like, can't even effectively digest and absorb our nutrients. We can't ward off any bad bugs, naughty microbes that start overgrowing down there. So it's just such a huge problem. The stress of our modern society could maybe be public enemy number one, I would say.
Yeah, that's a great way of putting it. And I'd love for you to draw the connection to trauma here, because trauma, psychological trauma is becoming a big topic. There's several people that you and I know who have been really on the forefront of bringing this to, more common public knowledge around the connections between trauma, particularly early trauma, and mental health. And I think especially when we're talking about kids, a lot of our listeners maybe have children who have come into their lives through the foster care system or adoption, where trauma has become more recognized as a factor. But I think we're recognizing that so many children, especially if they have symptoms of various things, have experienced different levels of trauma in different ways. And so to sort of, segue from the discussion of stress more generically into trauma, I'd love for you to talk a little bit about, the connection between trauma and the gut microbiome, the physiological stuff, and the mental health pieces.
Yeah, I'm glad that we're going there, because there is a lot of really interesting research coming out about it. And kind of like what we said at the beginning of the show, I mean, I'm glad that there's a lot more awareness and acceptance around trauma, right? We can't change anything without some degree of awareness. But I think there's almost like an over-fixation on identifying as being traumatized. Sure. Like me too, I'm also traumatized.
Right.
Which, I mean, first off, I think we have to recognize trauma, just like autism or ADHD or anything else. It's a spectrum, right? Yeah, we could be talking like more severe PTSD, like veterans, which is obviously a demographic I have a lot of passion for, versus other types of maybe more mild. And where do you draw the line of trauma versus kind of harsh conditioning and tough parenting? I think it's a little bit subjective. But I think what's really interesting, more from like a hard science perspective on trauma, is we're really starting to see that like adverse childhood events, early life stress, and childhood trauma it really does change the neurophysiology and neurochemistry of what's going on in the brain. So all my research around microglial cells, which are the immune cells of the brain, they help protect the brain from foreign invaders, and they help sculpt the brain. They have a huge impact on how the brain wires itself and how it develops early in life. And what we see through the literature, through all sorts of cool, observational studies and also animal research, is we see how some sort of stressful event or traumatic event, it actually skews these microglial immune cells to more of a pro-inflammatory phenotype, which really sets the stage for kind of brain on fire, if you will, that drives a lot of depression and anxiety. And so this is actually really cool. I say it all the time, and I guess I'll just say it for another decade or two, and maybe it'll catch on. But they're actually doing some really cool research, especially with rodents, where they'll take rats and they'll traumatize them to induce this neuroinflammatory brain on fire. And so then now the rats behave like they're traumatized. They exhibit anxiety-like behavior, depressive-like behavior. They're traumatized, and they measure those microglial cells and see like, yeah, they're very inflamed in the brain. And they're doing experimental research where they'll give some sort of therapeutics such as minocycline, which is an antibiotic that crosses the blood-brain barrier and quiets down those neuroinflammatory cells. And then the PTSD behavior goes away. So they're actually looking at different types of therapeutic compounds of, no, we actually might be able to clinically treat PTSD. It might not really be the psycho-emotional, like, oh, you just have to do decades of therapy with marginal improvement. But maybe if we actually fix the cellular dysfunction that occurs in PTSD, it can really reduce the symptomology. So I think it's a really exciting area of research.
Absolutely. And I love that you delved into that a bit, because I think there are more options coming out around that people are aware of, including things like, psychedelics, cannabis, ketamine, these kinds of things that I know a lot of parents, if they start to go down the rabbit hole of looking into the stuff, they're exposed to that. And, I know you and I share a similar viewpoint on that, while those things can be helpful therapeutics, there still is heavily, a masking component to a lot of those things, the potential for addiction, the sort of escape, mechanism that can be at play with some of those things, compared to some of the stuff you're talking about, where really, getting in there and changing the physiological structure, changing the way that the brain is, wiring itself, processing itself, changing the microbiome, all of these things that actually can resolve symptoms, that we don't just need to be focused on the psychological piece of, well, let's reduce the anxiety around it, or, help you to reframe it, or sort of approach it from a top down. This is really more of a bottom up kind of approach.
Yeah, we have to break out of the, pill for the ill mindset, right? Because a lot of what I like to do is, I'm looking at the mechanistic pharmacological research to see, all right, so like, for example, what's rolling down the big pharma pipeline, it's all about monoclonal antibodies these days, which I think amazing medical tool, great that we have them. But what they're doing, I think phase 2 clinical trials right now is, interleukin-6 pro-inflammatory, neutralizing drug. So this monoclonal antibody that basically just blocks the inflammatory signal, and they're planning on releasing it to the world as an antidepressant, a second line antidepressant. So, all right, we tried the SSRIs, that didn't really work. Let's try this drug instead that blocks inflammation. But what we see with the problem with those drugs is they're immunosuppressive. So maybe it improves your depressive symptoms, but now you're more susceptible to infection, which that's not relevant during an infectious disease pandemic. But we can use that same science to reverse engineer it of like, well, if that helps, and it's really kind of an inflammatory problem, knocks it, well, let's reverse engineer that and go from the bottom up of like, what can we do to improve the health promoting effects of the environment and the lifestyle? To me, it doesn't make any sense of, using some of these they're cool drugs. They're really cool. But why isn't the greatest medicine of all to teach people how to not need it? So that brings us back to, well, if there's obesity and fatty liver and gut dysfunction and they're not active and they're eating processed food and in a stressful environment, like, why don't we work on that, right? Like, maybe use the drugs accordingly, talk to your doctor, but
Yeah.
let's try to not need them, right? And we can use the same science to reverse engineer it.
And I think that's a brilliant point in the idea that, medications, pharmaceuticals can and do play a role for some people. And, as the research shows with almost everything therapeutically, pharmaceutically in mental health, you may get some short-term benefit, but over the long term, we have very, very poor outcomes, even for people who initially do well. And so my way of thinking, and I know that's really what you're getting at here, is if we need to use pharmaceuticals in the shorter term to help people get more at the root and make the bigger picture changes that are going to help them longer term, that's really where we want to be. And unfortunately, most people are put on medications, whether they work or not for them, and they're left on them, forever. And nobody's helping people do the work of longer term change to shift this inflammation picture, to shift the microbiome. So I'd love to have you comment on two things around this. One is, in the traditional world of mental health, behavioral health, a kid comes in, a teen comes in, adult comes in with symptoms. It's like, okay, here's our checklist, here's our assessments. Oh, here's your diagnosis. Here's your medication, and here's your therapist. So from an evaluation standpoint, what do you feel like are some important things, even on a more physiological level, that if you could wave a magic wand and change the realm of mental health and medicine, when a kid or an adult comes in with mental health kinds of symptoms or developmental kinds of symptoms, beyond the checklists and the observations, are there some tests? Are there some things metabolically, lab-wise, that you would like to see become sort of an initial standard of care in terms of how we're assessing these people?
Absolutely. That's been one of my huge kind of professional goals with this and developing my own panel, the mental map, because I was really bothered that I went through what I went through, and the only time any blood work was done was when I was in the intensive care unit. I think regardless of what the healing journey is, we have to be objective about it. And, I'm not saying that psychiatric subjective qualification is useless, but we have to be scientific. We have to be objective with it, because it's like, if you run some basic blood work on a kid and their vitamin D is at, 10 or 20, and their glucose is at like 120, and their liver enzymes are elevated, like they're metabolically compromised, right? And if we can improve the blood sugar regulation, improve the digestive function, if we can reduce inflammatory markers, like there's so many different inflammatory and nutritional markers that have all been studied in regards to mental health, like, mineral levels, right? Magnesium and zinc and copper and sodium, potassium, iron, right? So we have to be assessing these things, because there are so many nutritional insufficiencies that a lot of these kids have, right? Because it's paradoxical how the American population is overfed yet malnourished, right? Yes. So when you look at that in somebody's blood profile, and other tests can be helpful too, but it's like you see that the sugar and the lipids are all messed up, yet the nutrients themselves, the vitamins, the minerals, are all pretty low. And you see the inflammatory and oxidative stress markers creeping up and up. So you see, as those blood markers normalize, their behavior gets better, they feel better, the symptoms go down and away. So I like to really bring that objectivity to it. So that way, regardless of what intervention strategies you want to use in your healing journey, great, go do whatever you want. If that's psychedelics, great. If that's ketamine, great, psychiatric drugs, or some diet program, or go do whatever resonates with you, but at least be objective and seeing, like, is that actually improving my physiology using these really sensitive biomarkers? So there's so many that could be explored with that. And then all the while too, there's some of the more exotic things, like, the dysbiosis or mold, or some of these other kind of root cause subjects that are just not well known.
Well, and I think to that point, like you talk a lot about mold and toxic environment, and even like stealth infections, there's now more and more talk about things like, Lyme and Epstein-Barr, and these things that can really become problematic as kids get older and can create a lot of symptoms. And what I find interesting is that because in the field of mental health and medicine, we really don't delve into even the basics. Forget about delving into the more complex things. Like sometimes I'll have a parent come to me and they're like, my kid's having all these issues. And like, I've read about Lyme and I've read about all these things and I want all the tests done. And I say, well, let's start with some basics first, because often we can uncover some things there. And then it's sort of a layered approach of, okay, if we've got the basics now, if we've repleted, nutrient levels, if we're, getting inflammation down, if we're dealing with these things and somebody's still really struggling, now we move to the next level of, okay, what do we have going on here? And it's sort of like peeling back these layers of the onion. But unfortunately, the vast majority of children and adults are not even getting a basic level of care around that, let alone having it identified that, wow, maybe your kid's been in inpatient psychiatric units 3 times in the last 12 months because they have a high level of lead from where you live in the water supply, or because there's mold toxicity in the home that you just moved into, or they got a tick bite. Like, no one is thinking about these things.
Yeah, it really is unfortunate. And that's why on the mental map, I included a lot of immunological markers that are assessing for, inflammation and immune activation is sky high, or there's just so many of these factors that, and it can be hard too, because if you go down these individual root cause rabbit holes, you can kind of get lost and maybe even led astray, like you're pursuing a root cause that might not at all be relevant. So you do have to kind of bring it back to evaluating the physiology, which I think is such an important take-home message for everybody is, what is your physiology doing? And at the end of the day, blood work is by far the best way to assess physiology. But this is also where the difference of, having your conventional medical doctor looking at a blood chemistry from the perspective of, acute illness or severe medical instability versus more, functionality, right? You can't say that somebody with a blood sugar of 130 is the same as somebody with a blood sugar of 95, right. All the while, like, well, where should their blood sugar be? So, we kind of have to evaluate what's going on nutritionally and with the immune system and inflammatory levels, and then be thinking, well, what root cause factors from the environment or lifestyle are contributing to this physiological dysfunction? Like, yeah, there's lead paint in the kid's room, or the Wi-Fi router is right underneath their bed, or, oh, maybe that black mold might have something to do with it, or the tick that I picked out of their back a year ago, because those are all very, very relevant for disrupting neurophysiology.
Yeah. And I appreciate you, spotlighting all those things just to get the wheels turning for our listeners who maybe have delved into a bunch of things, or maybe just have felt like their kid is getting worse, is not getting, they've done all the behavioral things, they're doing all the things they're being told, and just to get people's wheels turning as to the number of things that may be going on. And that can simultaneously feel empowering and overwhelming, right? So I would say, like, just take it one piece at a time, but just expanding people's awareness around the number of factors here, because so often the message in mental health is, well, this is just how you are. It's how it's going to be. This is how your kid is. Like, better get some sticker charts out and give them their pills and learn to deal with it. And you and I know that is so far from the truth, even for the most severely impaired kiddos. So in a moment, I'm going to have you share where people can find out more about your mental map and those things. But I'd love to wrap up by panning out again. You did a beautiful job when you started. You said, let's take the big picture view. And then we kind of got into the nitty gritty. I want to pan back to the big picture and have you leave people with one or two things that you feel like every parent listening, every professional listening can be thinking about, can be doing to support kids' mental health. Maybe it's something physiological, maybe it's something lifestyle, maybe it's something spiritual. For all of our parents and our practitioners listening, what are one or two things that you think in the big picture are really important for us to be thinking about for our kids?
Absolutely. I think there's more pressure on kids than ever today. Kids are growing up way too fast. We're exposing them to kind of the horrors of adulthood way too early. And part of it's just their accessibility to the internet and everything that's on there. We see this shift in society, and like even with the movies today are not how movies were when I was a kid. They were, more rhetorical and feel good as a kid. Now they're gruesome. The ideas that they're programming, I think it's awful, but the three big buckets I think of are decreasing the kid's stress load, take some pressure off the kid, let kids be kids, let them be creative and wild and free, not trying to, well, we have to make you fit into, this bucket, this box, and we're going to medicate you until you're compliant. I think that's not the right way. That doesn't allow them to express themselves to the full degree of their authentic nature. So decreasing that stress load, looking at, is the environment they're in, hey, is the environment going to be conducive to them growing to their fullest potential? But also it's like, again, with my background in fitness and nutrition, it amazes me how, 99 problems, but being active and fit and eating real food fixed 98 of them.
That's right. Yeah.
So I think that if we can bring down the stress load, get the sleep hygiene up, feed them real, whole, nutritious food from the earth, get them moving outside in sunlight, get them social, that by itself can ameliorate the vast majority of the issues. And if that's being practiced consistently and they're still struggling, that's when exploring some of these root cause factors really becomes helpful.
I love it. I love it. I want you to share with people where they can find out more about you, about the work that you're doing, about your mental map, lab panel. Give us all the details.
Absolutely. Thank you so much. My website is metabolicsolutionsllc.com, and you can find everything related to me and my business on there. My Instagram is the Holistic Savage, and that's where I just pump out lots of good content. That's the main platform. But the mental map has been such a passion project, and I'm just ramping up my work with my not-for-profit research foundation, where we're going to be doing a lot of cool science around that. But the mental map is really a great test that we're, trying to get into the hands of as many practitioners and, self-healers, patients, clients, consumers as possible. And we're actually, exciting announcement, we're about to release an at-home version of that test because, we have like the venous blood draw, which that's, the most thorough, the most accurate, the most comprehensive. But, not everybody can do a big venous blood draw, especially if you have a young child and they're underweight or whatever. So we're developing an at-home version that's a finger prick and a urine assessment that still gives us really good data. So I'm excited about it. I think data is very empowering. So that way we're objective in what's working.
Yeah, I love that you're bringing more objectivity to this. It's awesome. The work that you're doing is so amazing. And thank you for everything that you're doing in general around this topic and to serve people and developing the tools and the resources that you are. And also thank you for spending some time with us today. This has been an awesome conversation.
Absolutely been my pleasure. I really appreciate you and the work you're doing as well. I think we're a dream team here.
Absolutely. And thank you as always to all of you for being here and for listening. We'll catch you back here next time.